Hi, my name is Francinet Perez. This is my NR302 final assignment, my head to chest assignment. This is Simone. Simone, do you consent to be in this video?
Yes.
Perfect. I'm going to start off the assessment by knocking on the door. Can I please come in?
Yes.
Hi, Miss VM. My name is Francinet Perez. I will be your student nurse today. I will be doing a quick health assessment. It'll be like a head to chest assessment. It should take about 15 minutes. Is now a good time?
Yeah.
Perfect. Can you just please tell me your name and date of birth?
Simone VM 4/13/96.
Do you know what time of day it is? Or
6
what
p.m.
time? 6 p.m. Can you just let me know? Do you know where we're at right now?
Rush University Medical Center.
Okay. And what brings you in today?
General health assessment.
Perfect. Okay. So my patient is alert and orientated ×4. So Miss VM, do you have any allergies that I should know about?
No.
Are you experiencing any pain?
No.
Perfect. Okay. So first I'm going to inspect my patient. So to begin with, her face is symmetrical. She seems pleasant. She's been having conversational. She's been having a conversation with me. So she. Sorry, can you scoot back a little bit? So she's been responding and stuff. She's been formulating her responses correctly. So if I'm looking at her body, everything looks symmetrical. She doesn't have any appendages missing. She looks well groomed. She is dressed appropriate for the weather as well. So then if I look at her skin, it looks pink it looks appropriate to her ethnicity with a pink undertone. And I don't see any exudate. I don't see any lesions. I don't see any signs of eczema, which is good. I do note a tattoo on her left forearm, and that's it. Okay, so then can I actually touch your skin? So I'm going to be touching for temperature. So you're warm to the touch bilaterally, and then I'm going to actually touch your skin again. I'm going to pinch your skin. So if I pinch your skin, there is a quick elastic recoil. There's no so there is signs of skin turgor. There's no skin tenting, which is good. If I can actually grab your hand, I'm going to look at her fingernails now. So they are they're clean. They're rounded. The bed of the nails is smooth. The actual angle of the nails is 160 degrees. And if I pinch it, because she doesn't have any nail polish, there is a quick capillary refill within 2 seconds. Perfect. Okay, so now I'm going to move to your head. So your head is midline to your body. And I'm actually, is it okay if I touch your head? So I'm going to be inspecting to see if I can feel any lumps, bumps, or exudate or lesions. Do you feel any pain?
No.
So no tenderness is noted as well. There's no signs of alopecia. Okay, so I'm going to move to your neck. So I'm going to be touching your lymph nodes. So I'm going to be touching your face. So I'm going to be assessing your pre-auricular, your posterior auricular, your occipital, your submental, your submandibular, your jugulo-digastric, your superficial cervical, your occipital cervical. Sorry, your posterior cervical, and then your deep cervical chain. And then if I have you hunch over, I'm gonna be assessing your supraclavicular lymph nodes, which are all good. So then I'm gonna have you move your neck if you can. So there's good range of motion. Perfect. Okay, so now I'm gonna be looking at your eyes. So her eyelashes are symmetrical. There doesn't seem to be any exudate coming out of them. There's no redness. There's no infestations. If I look at her eyelids, there's no signs of ptosis. If I look at her eyelashes have no signs of ptosis, there's no signs of infections or redness or anything abnormal. If I look at her sclera, it looks china white. If I look, can I touch your face and push your eyes down? The conjunctiva looks pink, moist, and intact. So if I'm looking at your pupils, they are equal, round, and now I'm just going to be inspecting to see if they react to light. So I'm going to grab a pen. Sorry, I'm going to grab this one. Okay, so if this was my pen light, I'd be able to flash it in each eye. So first I'm going to flash it in your left eye, and then your right eye. So if this was normal circumstances, I would say that they were reacted to light. So I'm going to now have you follow my pen. When I touch your nose, keep following it. So there, because she was able to do that, there was accommodation. So that's good. So now I'm going to be assessing your ears. So if I could have you turn. So first of all, I notice symmetry. If I'm looking at her ear, the pinna of her ear is aligned to her eye. If I'm looking at her external auditory meatus, I notice that she does have a piercing. It looks like it's been healed properly, and it looks like there's no exudate or redness. The exterior of the ear, again, doesn't have any redness or exudate. If I look at the inside of her ear with my pen light, there is no redness, exudate, or foreign bodies in there. If I look at the back of her ear, there's no skin lesions, there's no exudate, there's no redness. I'm going to actually touch it now. Do you feel any pain?
No.
I'm going to touch her tragus. Do you feel any pain?
No.
Okay, so there's no tenderness. I'm going to do the same thing on the other ear. Can I have you flip? Again, she has more piercings over here. If I look at her external auditory meatus, again, there it's aligned with the pin of her ear is aligned with her eye. There doesn't seem to be any exudate coming out. If I look at her internal auditory meatus, same thing. There's no exudate, there's no redness. If I look at the back of her ear, there's no redness. Sorry, there's no redness or skin or infections. There's no redness and no issues. So now I'm gonna touch it, and can you tell me if you feel any pain?
No.
Do you feel any pain when I touch your tragus?
No.
Okay. So is there any environmental exposure to loud noises?
No.
How do you clean your ears?
With water.
Perfect. So now I'm gonna move to her nose. So if I look at her nose, her skin seems to be appropriate to ethnicity with pink undertone. I don't see any exudate or any drainage coming out. I'm going to use my pen light to see if there's any foreign bodies. I don't see any foreign bodies. It looks pink, moist, and intact in there. So now what I'm going to have her do is occlude her nostrils to check for patency. So I'm going to have you cover one nose and breathe in. Do the other. So patency is noted. Also, it should be noted that the patient also has a nose piercing. But it looks like it's healed up nicely. There isn't any exudate or redness coming out of it. So now if I'm moving to her lips look pink, moist, and intact. Can I have you open your mouth, please? So if I look at her teeth are present. They are china white. There doesn't seem to be any decay. Sorry, that have you open your mouth so long. Okay, so they're white, like I said. They're aligned. There's no there's no foul smell or anything coming out of it. If I were to look at her buccal mucosa, it's pink, moist, and intact. If I look at her tongue, it's pink, moist, and intact. If I look at her hard palate, it looks pink, moist, and intact with a grayish tint. If I look at her soft palate, can you raise your tongue? Yeah. It looks pink, moist, and intact with a yellowish tint. If I look at the back of her throat, at her pharyngeal tissue in the back, it looks pink, moist, and intact. So if can I have you say ah, please? Okay. So do it one more time. Sorry. So her uvula rises with phonation, so that's good. There's no drooling, pulling in the back, so that means her cranial nerve 9 and 10 are intact. Okay. So moving on, now I'm gonna do your chest. So if I look at your chest, I'm gonna look at the back. So I don't see any signs of kyphosis, lordosis, or scoliosis. I am going to now check your transverse to anterior posterior ratio, which looks 2 to 1, so that's good. I don't see any heat. I'm gonna now inspect or actually palpate your chest. So I don't feel any bumps or lesions. Does that hurt?
No.
Okay, I'm gonna check your back now too. Does that hurt?
No.
Okay. So no lesions or bumps were noted. She did not express any tenderness. So now I'm gonna actually go to your back and I'm going to percuss. So every time that I'm gonna move your hair. Every time that you feel my hand, can you please say 99?
99, 99, 99, 99, 99, 99, 99.
Perfect. So even vibrations were felt throughout. So her tactile firmitis is intact. So now I'm actually going to auscultate, and I'm going to be listening to her lungs. Okay. So every time that you feel my stethoscope, can you take a deep breath in? Okay. So left upper lobe, right upper lobe, left upper lobe, right upper lobe, left lower lobe, right lower lobe. Okay, now I'm going to do the same thing in the front. Oh, sorry. I'm going to have you go this way. Okay. Not every time you feel my stethoscope, please bring it in. Left upper lobe, right upper lobe. And can I have you actually pull up your breast so that I can listen to your lower lobe? Now breathe in. Left bottom lobe, right bottom lobe, and then can I have you lift up your arm and I'm gonna listen to your right. Do it one more time. And that was her right lower lobe. Perfect. Okay, so now if I'm doing the cardiac portion of the assessment. So to begin with, I don't see any distension of her carotid or jugular artery, so that's good. Now I'm actually going to palpate her carotid artery. So +2 with regular rate and rhythm. +2 with regular rate and rhythm. So if I'm looking at her precordium space, I don't see any, there's no apical pulse noted. There's no lifts or heaves. So then I will be auscultating her heart. Sorry. Okay. So I'm going to be listening to her aorta. Or I'm going to be listening in the aorta space. And then her pulmonic, her Ebbs point. And then can I have you lift up your breast again? Sorry. Tricuspid. And then mitral. And now I'm going to be switching over and doing my belt. Aortic. Pulmonic. And then can I have you lift up your breast? Sorry. Tricuspid. Mitral. And then I'm going to leave it here and listen to my apical pulse for a whole minute. If I were to do it for a minute, for the purpose of this video, that was a minute. And so I noted S1 and S2. There was no S3 or S4 noted. So now I would tell I would ask my patient, are you feeling any pain?
No.
Okay, thank you so much. Is there anything else I can do for you?
No.
Perfect. Okay, so here's your call light. If you need anything, please please press the call light. The physician will be right in. And so I will thank you again for allowing me to do your assessment. I will perform good hand hygiene, and I am done.